All right, let's bring in my guest. Ezzedine Loulou joins me live now from Gaza. He's a medical student and is currently situated in Gaza City. Ezzedine, thank you so much for being with me on the program. So I first want to start off by asking you about the current situation in northern Gaza, especially following the latest attack on Beit Lahia. We do understand that there's a communications blackout. We're not able to get much information from the current situation there. What can you tell us on the current situation following that particular attack?
Thank you, Afnan, for hosting me. Actually, for around 2 weeks, the Israeli occupation has laid siege on the area, focusing on the Jabal refugee camp. Israeli occupation started bombing with even more intensity. To put it in perspective, in just 2 days recently, Israel launched 118 attacks in the northern Gaza, almost as many as the total for all of September, according to UN. In addition, paramedics received several emergency calls from citizens in the northern Gaza, and the civilians confirmed that many of dead bodies, as well as wounded injuries, are still lying in their residential homes, and many of the dead bodies are left on the streets, decomposing and eaten by stray dogs. The Israeli occupation forces continue to deny paramedics access to the bombing areas. Uh, Actually, healthcare system here in northern Gaza is nearly collapsed,
Hmm.
especially in Gaza. Every doctor and medical worker in Gaza is working around the clock. Uh, we're all coming together to do everything we can, but to be honest, the hospitals in the North Gaza are completely collapsed, completely horrific scenes. Uh, Supplies have run out. It feels
Right.
like
We are
something
actually
that,
hearing from medical staff that have been working in the northern parts of the Gaza Strip say that Israel has denied them access to any sort of aid, whether that's medical, humanitarian, food aid into the northern parts of the Strip. A lot of people are describing the situation there as Israel trying to exterminate and annihilate that whole part of the Strip. Can you give us some more information as to the difficulties that medical staff are currently facing in trying to tend to their patients?
yeah, actually, on October 1st, the occupation has stopped any aid coming into the northern Gaza. In addition, this week, Israel stopped allowing American medical groups into Gaza, like Fajr Scientific, Bama, and etc. These medical teams are essential not only to the civilians in their care, but also to us as a medical workers. They help lift the strain of us who have worked non-stop since this genocide began. Since the closing of Rafah border, we have seen smaller amounts of medical personnel allowed into Gaza Strip, and now it will be less. Actually, hospitals and ambulances are completely overwhelmed. All help we get from outside organization is urgently needed. Doctors, nurses, and any type of medical staff are desperately needed in every part of Gaza, and actually, we urge the world to intervene to stop this.
Azadine, you said that you've been working around the clock in hospitals. You were a medical student, a fifth-year medical student, if I'm remembering correctly, before all this started a year ago. Walk me through some of your experiences, some of the things that you've witnessed throughout your time at these hospitals that have faced the most catastrophic situations yet.
Actually, within the hospital, uh, I'm working in the Gaza hospital since October 2023. The injuries are unusual, with severe burns up to the fourth degree. These burns are not mentioned in the medical books nor studied in the medical programs. I did not expect to face them in my life, but Israel exceeds the expectation. I witnessed the besiegement at the Shifa hospital for a week on November 10th, 2023. For one whole week, was no electricity, telecommunication, and Wi-Fi. I was at the Shifa hospital. Israeli military tanks were approaching at Shifa hospital, so I started making videos to let the world know what was going inside the hospital. snipers were targeting the hospital and the hallows of the hospital. As doctors, we were not able to move towards them to save them. We were forced to watch people bleed out to death before our eyes. Oxygen concentrators had started to shut down, and 8 patients in the ICU just died before my eyes. For the first time in my life, I buried people inside the hospital. All this happened in that week.
And Ezzedine, I mean, as you express, you know, these harrowing situations that you've been experiencing over the last year, I mean, I can really see the trauma in your expression there. What's your message to the world for this to end once and for all?
Actually, we are residents, but we are not superheroes, you know? The cold weather makes everything more difficult in this situation, in this time. The constant sound of
Okay, Ezzedine, it seems like we were experiencing some technical difficulties. I think you were saying that the constant sound of the drones, take it from there for me if you can.
what?
We were experiencing some technical difficulties, but I think you were saying that the constant sound of the drones that you hear on a day-to-day basis,
Yeah,
and the effect that it's having on you and
yeah,
many, many people across the Strip.
yeah. It 24/7. The sound of the drones 24/7 that has not stopped makes everything everything it's terrible actually. Yani.
Okay, Ezzedine, thank you so much for your time and joining me here on TRT World and sharing your experiences with us. I really, really appreciate it.
You're welcome.